Hyperbaric oxygen therapy, or HBO, can help people heal from a variety of conditions, including wounds, ulcers, and even hearing loss. Today, we'll dive into what HBO therapy is, how it works, and what patients will experience. Joining us for this conversation is Diana Kuipers, the program director for the Center for Advanced Wound Care and Hyperbaric Medicine at Emerson Hospital. This is HealthWorks here. I'm your host, Caitlin White. To start us off, can you tell us what HBO or hyperbaric oxygen therapy is?
Sure. It's a way of using 100% oxygen under pressure to heal wounds. It's safe and it's pain-free.
So how does it all work?
Well, patients sit in a chamber and they're breathing 100% oxygen under pressure, and that causes the blood vessels to constrict and move the blood faster through the body. It's kind of like when you put a thumb over a hose and you see the pressure, the water goes faster around your thumb. It's doing the same thing with your blood flow in your body, and then the blood is flowing faster to the wounds, and it's bringing nutrients, food, and oxygen, and it helps the tissue heal faster.
So what are some kind of examples of people, like what might an injury or a reason to go to HBO look like?
So there's certain diagnoses that can be treated with hyperbaric oxygen. Diabetic foot ulcers can be treated, skin flaps from surgery that don't heal well, people who have had radiation to certain areas of their body, say if you had it around their neck or their mouth and later need to have teeth pulled, dentists will often say you need to get some hyperbaric oxygen therapy before you get your teeth pulled because it will help those areas heal faster. Other patients who might have areas, something called cystitis, when you bleed from your bladder after radiation, those are internal wounds, and hyperbaric oxygen can almost be the only therapy that can help stop that bleeding. We've had a lot of success with that.
So tell us more about the patient experience when they're doing HBO. Are they just locked in a room, or are they in like a pod? How does that work?
Yeah, so they sit in a chamber which is surrounded with a clear acrylic glass, and they're on a stretcher with a pillow and how many blankets they want, and they can watch TV or meditate or sleep. And at all times, they're able to talk to their nurse or hyperbaric oxygen technician. The therapy takes a little over 2 hours, and when you start therapy, you need to do it Monday through Friday for about 30 sessions, and that's the optimal healing time of treatment. And some patients will have an additional 10 depending on the doctor's evaluation after 30.
So it's almost every day for about a month, you're saying?
Yep,
Gotcha.
It is. It's like a slow, steady therapy.
Mm-hmm. And so what happens after, the 2 hours go by? Can they just get up and walk away and go home?
Yeah, they can resume normal activities. It's just during that 2 hour period when they're breathing 100% oxygen and pressure, and then they can go home and resume their normal activities of life.
Does the patient feel any different when they're in there? It sounds pretty comfortable, but what about, the process going on inside their body?
Well, it's a relaxing experience, but they do feel like they've exercised because your body's working hard when it's in the chamber, even though you're lying down on the stretcher. So patients often say that they feel tired, kind of like they had exercised.
Gotcha. So what does the research tell us about HBO?
So research finds that HBO can increase the healing rate by 50% when you're doing HBO therapy. That is to say, if you had a wound that would take 6 months to heal, and that's like a wound that it was down to bone, it might be 3 months at that point if you're doing hyperbaric oxygen. It can increase it that much.
So this sounds like a really incredible, innovative way to heal. How do I sign up for HBO therapy? Do I need like a referral?
No, you would just need to make an appointment with our clinic and have a medical clearance with one of our doctors. The doctor would assess your wound and see if it was appropriate for hyperbaric oxygen therapy and make sure that it's safe for you to do this therapy.
Great. Well, Diana, is there anything else you want to say to prospective patients out there?
I would say that here at the Emerson Wound Center, the staff is incredible at making patients feel comfortable and safe in their care. And when someone has a wound, which is scary and can be painful, I'm constantly surprised at how the staff here support patients and even make them laugh, and they enjoy coming to their appointments.
Well, thank you so much, Diana, for giving us an idea of how this looks and how it works. We really appreciate your time. You can call 978-287-8550 or visit emersonhospital.org/HBO for more information and to schedule a consult. And thank you for listening to the HealthWorks Here podcast. Subscribe to this podcast on your favorite podcast source, including Apple Podcasts, Google Podcasts, Spotify, or wherever you get your podcasts. I'm your host, Caitlin White. We'll see you next time.